I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Lori Hall, Program Consultant with the Division of Diabetes Translation at CDC. Dr. Hall, we learned today at Grand Rounds about how pharmacists can improve our healthcare system in the 21st century. What are some of the aspects of pharmacy and pharmacists that allow them to play that role?
Sure, John. One thing is the accessibility of pharmacists. There are approximately 67,000 pharmacists working in the U.S., and they're generally woven within the fabric of each community, whether it be an urban or rural setting. Also, pharmacists are among some of the most trusted professionals, yet they seem to be underutilized when you look at how they are trained and the experience that they bring to healthcare.
So beyond the functions that most of our audience will be familiar with of dispensing medications, what are some of the more advanced roles that pharmacists can play in improving healthcare?
Yeah, so as you said, there's so much more to pharmacy and what pharmacists are doing than just dispensing medications. We find pharmacists working to prevent and also control various chronic diseases such as diabetes, heart disease, asthma, congestive heart failure, among others. Pharmacists are also helping manage patients with HIV and giving immunizations. All of these diseases are very complex, and many are hinged on taking medications as the cornerstone of treatment. So it makes sense that a medication expert, such as a pharmacist, is involved in the process of treating these patients.
You know, it certainly does with people taking multiple medications, often for not just one, but multiple chronic conditions. So what have we learned about the benefits of having pharmacists involved in healthcare in these more enhanced roles?
Mm-hmm. One of the benefits is increasing the quality of health care. An example that comes to mind is when patients are hospitalized for one of their conditions and then they're discharged, their medication regimen could look completely different. And so a pharmacist that's assigned to reconcile the medication and also make sure that the patient is completely aware of their new list of medications increases the quality and also prevents the chances that an adverse event could occur that would then re-hospitalize them. We also see that investing in pharmacists and engaging in pharmacists can increase the patient's control of their disorder. A growing number of evidence shows that patients' A1C levels, which is a measure of long-term blood glucose control, decrease when a pharmacist is involved in therapy, as well as markers like lowered hypertension and high blood pressure, lower cholesterol and LDL, which is the bad cholesterol. So those quality measures, as well as the improved patient outcomes, are two huge benefits. And then we also talk about the cost benefits and reducing healthcare costs when a pharmacist is involved. The return on investment on average is 4 to 1. In other words, for every dollar invested, you save $4 whenever a pharmacist is involved. And some evidence even shows this can be as high as 12 to 1. So those are a number of benefits of working with pharmacists.
So potential better healthcare outcomes, potential economic benefits from really using pharmacists as you said during the session, as the medication expert on the healthcare team. Now, one thing I wasn't aware before today's session was that CDC has a number of resources available for people who want to learn more, or for communities that want to better engage with pharmacists. Can you tell us a little bit about those and where people can access those?
Yeah, absolutely. So all of CDC's tools are housed online. One of the useful ones is a program guide for public health. And the intended audience there are state health departments because they work on system level changes and approaches. And that guide has influenced state health departments to understand more about the scope of practice of pharmacists and encourage them to help scale and expand programs that utilize pharmacists, such as medication therapy management and just overall comprehensive medication services. Another tool that the Division of Heart Disease and Stroke Prevention issued was a toolkit on collaborative practice agreements, and they actually cater the toolkit to 4 different audiences, each with stake in having pharmacists work in that collaborative practice setting. So depending on whether you're a healthcare provider, a lawmaker, or a healthcare administrator, or pharmacists themselves, they cater the tools within that toolkit to the audience. And then lastly, as part of the Million Hearts campaign, there's a wonderful resource called Team Up, Pressure Down, and that targets community pharmacists themselves that are working with their patients to help reduce hypertension and prevent stroke and heart attack and other cardiovascular risk factors.
So really a number of different resources for a number of different audiences. Thank you very much, Dr. Hall.
Thank you.
Please join us next month for another segment of Beyond the Data.